Good afternoon, folks. This afternoon topic A is a broad one, so I'm going to explain that to you now. It covers the headline is let me give it. Reality: millions of older Americans die each year from preventable or manageable causes. So we're going to go through those today for A. So please join me for discussion A. Preventable reasons why people die. Here we go. The headline is crafted to grab attention by pairing a stark statistic with survival oriented question. It's not meant to describe one specific medical condition, but to frame the broader reality. Millions of older Americans die each year from preventable or manageable causes. Pages with this kind of framing usually pivot into lists of the leading causes of death and practical evidence-based steps to reduce the risk. Inviting readers to click through to learn what this means, which, give me 1 second, folks, almost always turns out to be the top 10 causes of death among older adults. The likely numbers behind 1.7 million, the figure 1.7 million is a starking, but it doesn't map nearly neatly onto CDC's official mortality tables. Instead, it echoes numbers often cited in health journalism. Sepsis incidents. About 1 in 7 million Americans develop sepsis annually, and it's a leading cause of in-hospital deaths. The number is sometimes repurposed in headlines of dramatic effects, even though it refers to cases across all ages, not deaths among older adults. Older adult mortality. CDC data shows that each year, well over 2 million Americans age 65 plus die with heart disease and cancer, accounting for the largest share. So while 1.7 million is not the precise CDC figure. It's in the ballpark of annual deaths among older adults from all causes combined. This illustrates how health headlines often blur distractions between causes versus deaths, or age versus older adult populations, or all age versus older adult populations, to heighten urgency. What top 10 causes usually means. When a page promises survival tips for the top 10 causes of death, it's almost always referencing the CDC's leading causes of deaths list for older adults. The ranking typically includes number 1, heart disease, number 2, cancer, number 3, stroke, number 4, lower respiratory diseases like COPD, number 5, Alzheimer's disease, number 6, diabetes, number 7, kidney disease, number 8, influenza and pneumonia, and more recently, COVID-19. Number 9, accidents, unintentional injuries, especially falls. Number 10, liver disease or other chronic conditions, depending on the year. These lists are paired with concise prevention strategies, lifestyle changes, screenings, vaccinations. And safety measures that can meaningfully reduce risks. Core prevention themes emphasized: cardiovascular health, control blood pressure, cholesterol, and blood sugar, quit smoking, exercise regularly, eat a balanced diet rich in fruits, vegetables, and whole grains. Cancer prevention, stay up to date on screenings, colorectal, breast, prostate, lung for high risk groups. Avoid tobacco, limit alcohol, maintain healthy weight. Respiratory health, avoid smoking and secondhand smoke. Manage COPD or asthma with medical guidance. Get flu and pneumonia shots or vaccines. Fall and injury prevention, install grab bars, improve lighting, review medications for side effects, and engage in balance strength training. Cognitive health, manage cardiovascular risk, stay socially and mentally active, treating hearing, and hearing loss, and maintaining regular sleep routines. Diabetes and kidney health. Monitor blood sugar. Follow up dietary guidance and adhere to treatment plans to prevent complications. Infection prevention. Vaccinations, hand washing or hand hygiene, and early medical attention for infections can reduce the risk of pneumonia, COVID-19, and sepsis. How to read the headline critically. The headline is designed to alarm and engage, but the real takeaway is practical. Most of the leading causes of death are not inevitable. They can be delayed, prevented, or managed through consistent habits and medical care. The 1.7 million figure should be read as a rhetorical device rather than a precise statistic. The actionable part lies in prevention strategies, the boring but powerful daily choices, and adding years of healthy life. In short, the page is less about a mysterious single killer and more about reminding readers that the top 10 causes of death are well known, measurable, and often modifiable. Okay, guys. So I did this show this afternoon for a FYI so that people could get screened for different things, keep up to date on their medical records so that people have a better chance at growing older with a better handle on having the best life possible for people. So that is why I did a this afternoon. With that being said, like I said before, if people have show ideas, comments about the shows I've done, leave it in the chat below for me, and I will see what I can do about getting you answers for your questions or comments, show ideas, things of that nature. So, with that being said, for now, Gator Wellness, take care, folks.